One of the reasons is due to something called midflexion instability, and what that means is that as a person bends their knee while they're bearing weight, their knee feels unstable to them. And the reason for that is that conventional off-the-shelf implants are unable to reproduce the normal function of the ligaments that stabilize the joint in a way that approximates the way the knee was prior to it being diseased. With the Conformis implant, because it provides a near exact reapproximation of the knee prior to becoming diseased, then the problem with midflexion instability is greatly minimized. And so, at least in the last year and a half, 2 years that I've been using this total knee replacement, I haven't seen midflexion instability as a problem with the iTotals as I have in other off-the-shelf designs. So this is a big leap forward, at least from my perspective, is that finally somebody's figured out a way to come as close as possible to replicate the knee the way it was prior to becoming diseased or arthritic. And that's truly revolutionary. I mean, that's not something that I've seen in the 20+ years that I've been practicing orthopedics. I've used a lot of the other uni-compartmental replacement products on the market. I think a lot of them are very good. With respect to the Conformis iUni, it is a bone-preserving product. So what that means to me, or at least what I've seen in my patients, is first of all, there's less bleeding and there seems to be less swelling afterwards. They seem to get their range of motion back a little bit sooner. Because it's bone preserving, I have less anxiety as a surgeon that if it ever were to fail or have to be revised, that I have a lot of bone stock to work with. I'm part of the iUni clinical study, so we've been following our outcomes with that in a pretty scientific way. I'm up to around 100 or so iUnis, thereabouts, and I've had great results. I mean, my patients are happy. When my patients are happy, I'm happy. The total joint I've been using for a little less than 2 years now, and I'm using it more and more as time goes by. As patients learn about it and see other patients that have had good outcomes, it's sort of feeding itself in terms of volume. And I've been very happy with both of the products. Well, the Conformis total knee products come beautifully packaged in a small box. You know, you open it up and all the parts are right there and they're organized in a way that's very sleek and efficient. And I compare that to an off-the-shelf implant where there might be 12 or 15 very large trays of instruments that are necessary for implantation just to accommodate all the different sizes and trials that are needed. So there are a lot of people that are happy about that. I'm happy because there's not as much stuff in the room, there's not as much commotion. When you're sterilizing 12 or 15 trays, not uncommonly, you'll find a hole in one of the drapes. That means that that tray wasn't properly sterilized. The process has to shut down and be re-sterilized, which can put you an hour or two behind easily in the course of a day. And when you have multiple surgeries going on and so forth, that's very aggravating. Even more importantly than me being happy, the nurses love it, because as opposed to having an entire room full of stuff that they have to inspect and lift and carry and organize, they have a little box with just a few instruments that can easily be laid out on a very small Mayo stand, and it's great. We've taken pictures of this and posted it at, in some of the talks that we give to the community on look at the difference between choice A and choice B. All things being equal, which do you think is better? Well, the answer is easy. You want the simpler choice. Simpler is usually better, and that's what we found with this implant.